executive team questions and answers. And we've got quite a few questions today that are COVID related. I'm Yolanda Martin, I'm Associate Director of Communications and Engagement. And I'll be introducing you into John Brewin. And the first thing that I wanted to mention was we've got some new slides for MS Teams backgrounds that you can put your name and job title and team on if you wish. Several people have been asking for them and we've now got those live on Connect. I'll put the link in, or I'll ask Jordan to put the link in the chat as to where they are. And if I could now hand over to the boss, John Brewin.
Thanks, Yolanda. Afternoon, everybody. Welcome. Hope your day is going swimmingly, and this is going to add a little bit more happiness to it. So I've got from the exec team, Lorraine, Director of Finance, Julie, Director for Mental Health and Disability, and Sue, Forensic and Medical Director. It's good to see you all. So, and as if from nowhere, Anne-Maria, our Director of Nursing, AHPs and Quality. Weren't expecting you. Whatever you do, don't switch your microphone on, Yolanda. We've got a packed programme, just a few sort of bits of introduction context from me, and then we'll go into the questions. One of the really important things, as you know, is how we ascertain how we're doing overall as an organisation. Staff feedback is a really important thing. We're still got something called the National Staff Survey Pulse Survey open, which again is a series of short series of questions that we're encouraging as many people as possible to fill in. As ever, it's anonymous, and it's been newly introduced this year as to complement the National Staff Survey, which is annual. And I think there are three or four of these through the year, just to give us sort of an in-between check. So far, we've had over 1,000 people that have responded. It doesn't come to us; it goes off, and we get the results back. But it's a really important part of the ongoing sort of engagement feedback stuff. So if you could pass that on and remind people to press the buttons. We're still predominantly two major topics of conversation in amongst all the other business as usual, running services, running organisation. As Yolanda said, the first is the pandemic, COVID and vaccinations, and the second one, just wanted to briefly mention, is the CQC. So everyone aware, we're in the middle of wave 3. It looks like cases numbers are starting to reduce, which is really good news. Obviously, the impacts of getting ill, getting into hospital, and subsequent complications will take probably 2, 3, 4 or more weeks to run through the system and have their own peaks before they start to fall. But as a consequence, the next month, 2 months is going to remain a real challenge in terms of people being off unwell, staff getting pinged, staff having to isolate. But it's prevalent out there, and we've got to maintain our vigilance and make sure that we do the right things. So I hope this doesn't come across as too sort of preachy, but the next 2 bits are really, really important, because we're in an okay place, but we're not in a great place with regard to both vaccinations and the use of lateral flow testing, and doing all that really tough day in, day out, social distancing, using PPE. And I know I say this on a regular basis, but please, can you look at it from your perspectives in terms of sharing it with your peers, your leadership roles, on what is the right thing to do. So on the vaccination programme, overall as a system, we've done pretty well. We've done over 1.2 million jabs in the county, and we've got reasonable good rates of staff vaccination. It remains that it's not mandated, but we've got about 1,000 staff who haven't been vaccinated at all. I really appreciate the hesitancy, the concerns, but it's really important that people reflect on their professional responsibilities. If you are working particularly in clinical environments where you're having patient contact, there is a professional responsibility to receive the vaccine. We're having, we've now got outbreaks again in a couple of areas in the organisation with staff that haven't been vaccinated. If you're still unsure, if there's still questions, things you want to talk about, feel free to avail yourself of the various routes in to get clarification. But can't underline enough and emphasise enough the importance of getting vaccination. As a sort of note to that, at the end of last week, there were 19 patients on intensive care at Queen's Medical Centre in Nottingham, and of those 19, I think they were all under 64. So this isn't, you know, all old people that are getting ill and admitted to hospital. But 17 of those 19 had no vaccine. So it's really clear the benefits of having it and the protection it gives you. Yes, it doesn't stop it completely, doesn't stop cases, but they reduce transmission. It doesn't stop transmission, but it reduces it, and it reduces people's chances of getting really ill, and you know, the impacts of long COVID, etc. So that's the first one. The second bit is around lateral flow. So there is a requirement for people coming into work to do lateral flow testing, and more importantly, to record it. And at the moment, we know that our recording rates are really low. And again, going back to where there are outbreaks, we know that when asked in retrospect, it's either not been done and it's not being recorded. And there's a professional responsibility in terms of protecting yourselves, protecting your peers, and protecting patients, to know as close as possible what your COVID status is. So again, in terms, if you could please spread the message of the importance of this as an organisational priority, and it will help and protect us over the coming months, because despite being vaccinated, it, you know, as I said, it doesn't stop you getting the illness, it doesn't stop you transmitting it. So we've still got to continue to use the social distancing, the face, space, place, race, whatever it is, keep ventilated in the environments you're in. It's critically important that we don't let our guard down on that. So end of preachiness. I hope that you'll sort of receive that with the way that it's coming out. It's critically important for us to get this right. And the final bit from me before I come back to you, Yolanda, for questions, it's just to further sort of update on where we are with the CQC. So we're continuing to do all the various prep events, and a number of the exec and a number of you are involved in bringing that together and helping support our staff in hosting what hopefully will be a successful showcase of the great work that we're in progress of putting together across the organisation. We think that an inspection is going to be imminent. It will be unannounced, but the various engagements and conversations we have across the system with other leaders is that we're predicting that we're probably next, and that sometime early August is probably the most likely time. So again, look out for more regular updates, more requests for things to be done, to check stuff, because that's the way of the world when we're in the sort of final home straight of getting ready for a CQC inspection. but obviously we'll keep people appraised of that as much as we know. It's likely when they hit, like we said, we won't know until they're here, and they'll go into a fairly familiar inspection routine. Other organisations are saying that they tend to last longer. It will then flow into a well-led review, so they could be here, there and back over a number of weeks through the summer. But we're in a good place, and we've done a lot of really, really good work, and we've got to continue to make sure that people feel confident about hosting it. So I think that's probably about enough from me for now, Yolanda. I'm going to go back to you, and we'll start to go through some of the questions. Thank you.
Thanks, John. We've got a couple of questions that are non-COVID related or non-vaccine related, and then the remainder of the questions are all COVID. But if anybody has got any additional questions, there's still time to put them in the chat today. So just drop them into the message chat. That'd be great. So the first question, I'm going to go to Sue Elcock, our Executive Medical Director and Executive Director of Forensic Services. Sue, somebody's asking how we can support medical staff to make the best of the opportunities on offer or respond to the demands of a changing health and care system, please.
Thanks, Yolanda. Hi, everybody. I really welcome questions from all professionals, but I have to say, since I've been in the trust, we've not had that many come that are specifically around doctors, so it's actually very nice to have a little bit more of a specific question. So thank you, whoever's put that forwards. It is very broad, so I'm hoping that what I'm thinking about is where whoever has submitted this is thinking. For me, there's two bits to it, really. There's the internal bit about how we're making sure that we've learned some ways of working differently over COVID, because I know everybody's worked very differently, and there's a lot of desire to make sure that we take that forwards in the best way for everybody, including the patients. So there's a bit about that. There's a bit about how do we make all of the medical posts, if I'm honest, really as good as they can be in this trust for people, because we need to be a trust that really values its medical and broader workforce, such that those posts look attractive. Colleagues will know, or may not know, to be fair, that we've got certain hotspots where it's really difficult to recruit doctors, both in terms of consultants and different grades of doctors. And that's quite an unusual position for NOTS in terms of it not being as attractive in some areas as it used to be. So there's definitely something about how we value those posts and make them as doable and therefore as enjoyable and attractive for people that are in them. There's then the broader thing about the ICS. And so for me, again, sort of coming in over last year, I don't see as many of our clinicians broadly involved yet in the ICS. It's very much at quite a senior level, if I put it that way. And I think as we move to obviously towards the proper go live and the running in shadow form, as we look at the clinical leadership across the ICS, it's going to be really vital that we get the right clinical directors and clinical leads, medics, etc., involved in those work streams and hearing that clinical voice. So for me, there's a sort of internal and external part that we need to make sure. But I would say, if I haven't answered your question, also please feel free to make contact with me. One of my pleas, I had a meeting with some couple of consultant colleagues this morning, was, please, if you're out there, invite me to things. I really need to be able to link up with all of the consultants across the trust and with the associate specialists and with the staff grade doctors, because we've got a variety of colleagues. So I'm going to use this blatantly to also put a plea out to say, can you please link me in as well? I'll hand you back to Yolanda.
Thank you, Sue. And they do say be careful what you wish for. So when your diary is inundated with requests to attend stuff and you're having to sort through it, that'll be great. The next question is about the annual general meeting, which took place last week, and asking if it's available on the Trust website. Yes, it is. It's available now. I'll put the link in the diary. 90 minutes of thrilling business about the Trust from the past year. We're also currently organising a second recording that will include sign language interpreters, and that'll be available within the next few days. So I'll make sure that that's on there as soon as it's available. Next, I'm moving to Lorraine. And Lorraine, the question for you is about the restrictions on the number of people in non-clinical offices and meetings. Has that been lifted? Has the restrictions on the number of people in non-clinical offices and meetings at any one time been lifted? If you wouldn't mind answering that, Lorraine, that'd be great.
Of course, thank you, Yolanda. So good afternoon, everybody. I'm Lorraine Hooper, the Director of Finance, Information and Estates. So the very short answer to this question is no, none of those restrictions have been lifted. So our non-clinical offices and our meeting rooms are healthcare spaces, just like the other areas in our trust. And so all of those requirements that have been in place for the last 16, 17 months or so remain in place. So things, I'm sure everyone is well aware of wearing masks when you need to be, hands, face, space, cleaning your hands and your desk, etc. All of those things remain in place, and including social distancing as well. Alongside that, the estates team and the property team within estates are working with some of our teams about the preparedness for coming back to the offices as we start to think a little bit more long term, and making sure that we've got measures in place for everybody's safety and well-being as there start to be more and more people in the offices and the non-clinical areas. So hopefully that helps, but if there are any more specific questions, as Yolanda says, put them in the chat and we will do our best to answer them.
Thank you, Lorraine. Don't turn your microphone off just yet, Lorraine. We'll stop spotlighting you, but you might want to come in on the next question, which I'm going to bat over to Julie Attfield. So the next question is quite a long question that's asking about, we start looking at a plan to gradually return to the workplace. Other than the periodic short visits to the office on their own, we've been successfully working from home for the last year, sort of querying whether they do need to come back into the office. So I just wondered if I could hand over to you, Julie, for that, to answer that question, and then Lorraine, you might want to come in and add anything afterwards, if that's okay. Over to you, Julie.
Hi, yes, so I think there isn't a one-size-fits-all answer to this, and I think the temptation is to give people a one-size-fits-all answer, but there really isn't one. So the first thing to reflect is what Lorraine's just described about our IPC, our PPE practices haven't changed. So in terms of offices and office accommodation, meetings and so forth, those limitations still apply. So when you are planning to return, it's about anticipating how you can do that with the environment that you've got to work in. So that's probably one of the first things to say. And that, as we know in this organisation, is completely different depending on wherever you are, really, and whatever you do. The second thing is about the work that we do. I think it's quite clear that, you know, for some people, they've always been in the workplace, and, you know, jobs do vary, and the level of flexibility that we have does vary too. I would also say that, yes, a lot of people have successfully worked from home, and to a degree, some of that will continue, but also we have, I think, sort of compromised some of the things that we do by not being in the workplace. So I think that there is something about, for some teams doing some work, there is a level of presence that we haven't had, that we do need to you know, get back to working towards. So I think for some teams, it's not necessarily that you can't work at home. It's a bit about, for some of the things that we do need to increase the level of presence. And I think also being fair about that in terms of workload and other colleagues. So, you know, circumstances where some people have come in all the time and some people have worked at home all the time, perhaps doing the same jobs isn't really a way to carry on. So I think there's some adjustments that we're having to make, and I think that does need to be a management team and a team conversation about how we get to change our working practices, really, and that's going to be quite variable. And I do appreciate that for people who've who've not been out and about over the last year, that is anxiety provoking. And you know, I think, as well as thinking about that, you know, if you do abide by all the guidelines, particularly around PPE, you're less at risk coming to work probably than you are going to the supermarket or any of those other places that you might contemplate going. And especially if you're going nightclubbing, I've got to mention the word nightclubbing at least once in the Q&A. But so that it's not straightforward, but I think, you know, we are going to have to grapple with some of those adjustments, and Lorraine may want to add something to that.
I'd only very briefly add that I agree with you, Julie, about what we might have compromised on, and individual teams need to think about what that is for them. It will be different for individual teams. The one other thing I'd add, I guess, is, well, two things actually. One, the Trust now does have, and I'm sure Jen Guyver will pick me up if I've got this wrong, the Trust now does have an agile, flexible working policy. I'm not sure what the official name is, but to support those conversations. And for those staff where this is anxiety provoking, our health and wellbeing services as well, that can be accessed to help support coming back into the office where that does erase those anxieties.
Thank you, and Jen's very helpfully put in the chat a smiley face, which presumably is thank you for mentioning that, Lorraine, and it's called the Home and Remote Working Policy. So there is that policy there, and thank you for a very comprehensive answer from both Julie and Lorraine. We weren't expecting Anne-Maria to join us on the call, but she's with us until about 1:30, and then she's got another meeting. Anne-Maria, assuming you're still there, I think you might have your camera switched off. You're switching it on now, great. The question we're going to come to for you, Anne-Maria, please, is somebody's asking, are we experiencing more COVID cases or any outbreaks at the Trust? John gave a bit of an overview when he started the call today, but if you could give us the detail on that, Anne-Maria, that would be really, really welcome. So I'll hand over to you now. Thank you.
Thank you, Yolanda. Yes, so the long and short of it is, yes, we are experiencing an increase. So about 4 weeks ago, we declared our first outbreak in the community district nursing team. And then last week I declared an outbreak, last Wednesday evening, I declared an outbreak on an inpatient ward. So we are currently experiencing two, what I call, on the truest definition, an outbreak. Now, an outbreak is if it's one patient, one staff, two patients. So it takes two cases that are linked together in order to call it an outbreak. Now, this is a bit of a plea actually on this one. As soon as you have any positive cases, whether that be staff or patients, it's really important to fill in an IR1 form so that we've got an understanding of where those cases are across the organisation, across the Trust, so that we can start to map cases. We've got about 20 odd staff at this moment who are COVID positive for one reason or another. The COVID outbreak that we've got on one of the inpatient wards is now 4 staff and 3 patients, and they are all interconnected with each other. Unfortunately, the inpatient unit, none of the staff were doing lateral flow testing, and we could have prevented the further spread if we'd have picked up some asymptomatic positive cases. That is what lateral flow is there to do. That is really disappointing. I can't deny it. I'm saying to you, all of you, that if you are not doing your lateral flow and you're working in a clinical area, you must do that twice a week. We are also considering asking staff to do lateral flow before they come to shift, and to show that they've done that. And we've had to do that in all of the outbreak cases that we've got. The other thing is that some of those staff that are now COVID positive are unvaccinated staff. So we still have, and I know John's mentioned this, but I'm going to mention it again. We have nearly 1,000 staff that are unvaccinated. And John's already mentioned all of those unvaccinated people that are sitting in intensive care unit on a ventilator. So I'm making this as strong as I possibly can. I'm saying to you, you have a professional responsibility for those vulnerable patients that we care for, that rely heavily upon what we do each day, day in, day out. And that is lateral flow testing getting vaccinated. The flu campaign will start soon at the end of September. We'll start the flu campaign again. And again, that's another mechanism to support our vulnerable patients. So with regards to outbreak, yes, we are absolutely experiencing outbreaks. Yes, we are seeing more and more staff being COVID positive. And that's a mixture between staff who are unvaccinated and staff who have had their vaccines. And that's pretty much it. I know there's another question actually that I won't go into now, but yeah, that's as much as I can say really at this point.
Thanks, Anne-Maria. If you wouldn't mind just staying there for one moment, there's just been an added question in relation to what you've just said. So Michelle McFarlane's asking, would there need to be an IR1 completed if the staff member is working at home?
If you have not been into work for the last 14 days, then and you're working from home for a period of time due to, well, I don't know, maternity leave, sickness, you've got flexible working from home, then no.
Okay, stick there one moment, Anne-Maria. There's another question come in, which I know that you know the answer to. Are line managers allowed to know who in their team is vaccinated, or is that confidential?
It is absolutely confidential. And when I chair an outbreak meeting, I do ask whether or no we know what the vaccination status of staff are, but they don't have to tell us. They do not have to tell us what their vaccination status is. It is confidential. But what I'm saying to you is what I know. I know that those staff weren't vaccinated. We know that the patients that are in ICU are not vaccinated. So we know those things, but no, we're not allowed to ask.
Thank you. Right, I think that lets you off the hook and you can go to your other meeting now.
Thank you, next one. Take care.
Thanks for joining. I need to move over to you now, John. Somebody's asked a question about how the uptake of the vaccination programme is going. So I could hand over to you, John, to take that question. That would be superb. Thank you.
Thanks, Yolanda. So yeah, as I mentioned briefly in my introduction, it's going pretty well. We see the figures, don't we, nationally, every day on the news. It's Nottinghamshire, and I think probably most of the counties in the East Midlands actually are either about average or above average compared to the national numbers. Derbyshire, to their credit, are slightly higher, perform really well. I think ourselves, Leicester, Northampton are probably, and Lincolnshire probably quite similar. So the really vulnerable cohorts, you remember cohorts 1 to 9, so the very elderly coming down the age range, the clinically extremely vulnerable. All of our county percentage uptake is 90% or above for those cohorts. So that's a really positive uptake. And then there's a bit of a generalisation. As you go down the age range from there, the uptake gradually falls off. It falls off quite markedly from sort of 40 and below. And the age groups of 18 to 30s is the lowest. And it's roughly in the 60s%. I can't remember exactly what it is off the top of my head, but it gives you some sense of the difference. And that's replicated across the country, really. Again, as a generalisation, there are some variations, but that's a fairly general message. Within the different vulnerable groups, as you would predict, the more socially disadvantaged, particularly in the city, where there are more people that are disadvantaged, and Mansfield, the uptake rates are lower. And again, that difference is greater in the younger age groups. And again, there's within the Black and minority ethnic groups, the uptake is lower than in the white population. And again, the age groups show a similar sort of variation. So in the very elderly, the groups in the BME communities are almost on a par with the white population. And as you go down the younger cohorts, again, the gap grows. And there are again, I know that's quite generalisations because there's a lot of different minority groups, but the lowest uptake is in the city of Nottingham, in some of the black communities, and actually in some of the Chinese communities. That last one comes with a bit of an asterisk, in as much that there are relatively small numbers of Chinese people living in the city, apart from students, and quite a number of those students may not be around locally at the time, so that number isn't as accurate as we know. But there's also been I think one quite high profile death from a vaccination from someone from China, and I think within their community that's been an obvious tragedy, but also a concern about people from China availing, or Chinese people availing themselves of the vaccine. So it's getting a bit detailed, but just to give you a sense of the variation. But overall, the programme has been, as you can see yourselves, nationally a success. It's been a good rollout in the county. There are a couple of other vulnerable groups that are quite high profile at the moment. So women of childbearing age and women that are pregnant, there's some specific guidance. I don't know whether we can, if that's on Connect, or we can put that in a link in the chat, Yolanda, for people that might be interested in getting a bit more detail. Again, nationally, they're finding that there are quite a large number of pregnant women that haven't been vaccinated. So there's specialist advice there about what people need to do in those circumstances. And the status of the programme at the moment is we talk about phase 2 and phase 3. So phase 2 is the big push that we've been having to get to July the 19th for those top 9 cohorts to be over 85%. Phase 3 begins in September, and that will be for booster jabs, and it will align with the flu programme. And we'll see a much bigger shift into that being provided across primary care by vaccination roving teams, rather than being hosted by bigger secondary care organisations like ourselves or Sherwood Forest. So that's quite a marked change, and that's just been worked up in terms of how that will be operationalised over the coming weeks. Is there anything else I need to say about it? The only other thing to say is, again, to reiterate, if you're still not sure, ask. If you think you've missed your cohort, you haven't. All our centres remain open. They're not all open all the time, but there are centres open across the county all the time. You can book, and all of them are doing walk-ins as well. So there's no barrier to access. In terms of, if you think you want to go and get one, pop in tonight on your way home. Thank you, Yolanda.
Thanks, John. We'll also put some of what you've said today into your message that goes out to staff later, so that we can promote the vaccination message again. Moving over to Julie now. There's just a couple of questions here for you, Julie, please, if that's okay. So somebody's asking what they need to do if they're planning to travel abroad. So that's before they go, and also when they come back, Julie.
Yeah, I cop for this one because I follow the travel news, much to the amusement of some of my colleagues. So, well, the first thing is, do you really have to, need to go? Because travel abroad is, it's a bit fraught. You only have to read the news. So if you are contemplating travelling, I advise that, you do watch what's happening in the news. If you're a bit sad like me, you can study the coronavirus trends and figures in any foreign country you like. And obviously what you have to do needs to align to the government guidance, and that's available on the gov.uk website. So wherever you go, it's testing before you go and testing before you come back, pretty much. And just to say that there is a risk, you know, you think you might be all right choosing to travel to an amber list country, but most of the common holiday destinations, there might be amber at the moment, but they're definitely, some of them are really at risk of going to amber plus, like France did a couple of weeks ago. So that means an additional 10 days quarantine that probably, you know, nobody would have anticipated. So our ask is that you talk to your line manager, particularly about where you're planning to travel to, and you do have to obviously conform to all the guidance about the testing. The testing's not cheap, and it, you know, it is a lot of hassle if you're planning to travel. I speak from experience. I was supposed to be in France last week visiting a friend, but I actually went to South Wales because I couldn't face it. So you know, just think about just where you're going and your planning really, and plan really carefully if you do want to go. But you know, I had a great time in Tenby, so I'd, you know, give it some serious thought, but do let your manager know and think about how difficult it will be if some of the legislation changes, especially whilst you're away. So we're all sort of you know, risk assessments are business, so I would advocate doing plenty of that before you travel.
Thank you. Linda's got a hand up. I'm not sure whether that's to add something or to ask a question, actually.
It's to add on to what Julie is saying. I just wanted to share with colleagues that some of the countries that are on the UK red list have also put UK on their red list. So going into some countries, African countries that I know, you're looking at paying at least $1,000 for compulsory quarantine, and the days are variable. It's not all 10 days, it's not all 14 days. So if you only had sort of leave of 2 weeks, that's it. So yeah, it's worth really checking with the most up-to-date information from those countries instead of just asking a friend, because it's changing quite rapidly.
Thank you, Linda. And as always, we put the link in most of our communications to the gov.uk website. That is where the most up-to-date information is found. So anything that's in printed format pretty much goes out of date with the same day it's printed. So always turn to that gov.uk website for your advice. That's where the trusted advice is. Don't believe everything you read and see on social media. Sticking with you, Julie, for the next question. This is in relation to a trust outbreak. So this is an outbreak that happens within the organisation, and they're asking, what should I do if I'm contacted as a close contact in a trust outbreak?
Yeah, so, well, this is quite straightforward, really. So if you are contacted as part of the outbreak, you'll be advised what to do, actually, and be very clear whether testing's necessary and where you can get your test. Test isn't negotiable at that point, and you need to seek your test urgently, or at least on occasions as well, we provide that for you to get it completed in the workplace. So if you are contacted, we'll be telling you about how to get your test and where to get it. But you do have to oblige and get your test with a degree of urgency. We do get the results within 24 hours as well. So it's a very important part of managing the outbreak situation. But if you've got any issues about any of that, you know, do talk to your manager, or you can use the COVID-19 testing email address or our phone number about your test and management of the result. That's quite straightforward.
Thank you, Julie. I'll drop those to the email address and the phone number into the chat. If I could just hand back now to John, that's the end of the questions for today. So if I could just hand it back to you, John, to sort of sum up and close us down. Thank you. Oh,
was it another question snuck in from Jenny? I'll let you read that, Yolanda. Well, actually, should we do that first before I do the summary, because it's related to testing? Is testing, if pinged with close contact, the same for people working in non-clinical areas? I think that testing advice would apply across the board.
Thanks, John.
Yeah.
Leave it to you to sum up then.
Thank you. Right. Thanks very much, everybody. I mean, these are the hard yards, aren't they? The sort of tough times, and we discussed this in exec team this morning. I think the next couple of months, particularly, is going to be a bit of a slog. We appreciate the very professional approach that staff are taking. We appreciate the challenges of managing, across all our sectors. We're seeing increased demand, increasing acuity, and again, not just in the organisation, primary care, ambulance, EDs are as busy as they've ever been. You overlay that, it's holiday season. It's going to be a challenging few weeks, but we have our trust values and behaviours for a reason. Continue to bear in mind that everybody's got an awful lot on, not just at work, and we're all juggling challenges in our family and at home, and just having that sort of compassionate eye, that word of support, of making sure that you get downtime and breaks and support each other. We'll get through it, and never forget that, pandemic aside, organisationally we are, we've done so much really positive work over the last few months, over the last couple of years, and we're getting some external feedback on that. I've just completed my board report for August, and it's a big long list of people that have been shortlisted for national awards, that are finalists and winners. And that's a really pleasing to be able to say that, and as part of making sure that we recognise the great work that staff are doing. So we will carry on. Everything will be fine in the end. Just a bit of choppy waters to get through first. And just a final reminder about lateral flow vaccinations, and lots of places you can clarify if you're uncertain about things. And on that note, Yolanda, I think I will draw us to a close. Thank everybody for their attention, their contribution, and I hope you all have a very pleasant afternoon. Thank you very much, everybody.